Hi Shahnaz, welcome to the show. A tremendous honor to have you. Could you introduce yourself, please?
Yeah, thank you, Akash, for having me. I'm Shahnaz,
Pleasure.
and I'm Shahnaz. I'm a psychologist, rehabilitation psychologist by RCI, and right now I'm working as a psychology counselor at Woxsen University, Hyderabad, and I'm heading the student wellness cell over here.
Right. So the topic we are choosing for today is suicidal fantasies and self-mutilation. So could you describe what self-harm means?
Yeah, self-harm for me, what I have understood so far is a deliberate attempt to harm oneself physically and
Mhm.
inducing some kind of physical pain. And there could be various reasons actually
Mhm.
for that particular behavior. Uh, in my experience and my work that I have worked with children, young adults, and some adult population, uh, basically what I have understood so far is some of the
Mhm.
individual they use it as a coping mechanism.
Right.
Sometimes the emotional pain becomes so much they are unable to handle it, and they kind of find an outlet through the physical pain. Oftentimes I have also heard some individuals say that I am not feeling anything, so I just wanted to feel
Feel something.
something, feel something. And sometimes it could also be feel a sense of control for themselves, because the outside world might feel so disoriented and they feel so disconnected, and there is no sense of control. So maybe body is one part that is still in my control, and I deliberately harm myself. I think that's what I broadly understand about self harm. And whatever I'm describing, it's more of my experience and my experiential learning over the years.
If we talk in terms of biochemical, so could it be that endorphins are released when you try to injure yourself? That be a particular reason.
I'm not very sure, Akash, about that aspect, but
And
when since we are talking about, some people use it uh, as kind of, coping mechanism, right?
Mhm.
There is a temporary sense of relief we can
Mhm.
understand. And when we are talking about temporary sense of relief, there is some kind of chemical reactions definitely in the body that happens, which takes away your emotional pain away for some period of time. But it's only
Mhm.
a matter of fact that it again comes back to you, right?
Right.
Because we are not dealing with that emotions at that moment. We're just kind of pushing it away with something more painful
Mhm.
physically. Again it kind of comes back
Mhm.
to us, right?
Right.
Yeah.
So, jumping to the topic of suicide, if someone is having high suicidal fantasies and you're a mental health practitioner, so how can you ethically deal with the situation?
Okay. First of all, um, when we talk about suicidal ideation, I'll just like to correct a little bit. We don't talk it as fantasy. We talk
Sure,
it
sure,
kind of
sure.
a suicidal
Sure.
ideation, right? So when we suicidal ideation is kind of a broad
Mm-hmm.
term, and there are various ways of understanding it, right? So first comes maybe the thought of, wanting to die, the contemplation that is happening in one's mind. Second could be the intent, whether the
Mm-hmm.
person is actually, kind of thinking in that way, whether there is an intent that the person wants to die.
Right.
The third is the planning stage, where the person is actually have plans or making plans, right? So as a psychologist or as a counselor, it's very important to assess this, because when a person is coming to you in the
Mm-hmm.
first session or the second session, generally I do it in the first session to kind of, check for the risk of the client, current risk of the client. Is there any suicidal ideation? If there is any ideation, is there any intent? If there is intent, is there already a plan? So that's how I kind of, see it, and that's how I kind of systematically process it. And ethically, I would say it's very important for your clients to know that the limits of confidentiality, right?
Oh,
So yes, when we kind of brief the clients on the sessions, generally we do it in the first session itself, that
mhm,
everything you talk to your counselor is absolutely confidential. There's no way that there's someone else would be assessing this notes or the talks of the therapy sessions. But there are limit to confidentiality where if you are at risk of harming yourself, or someone else's life is at risk because of you, so in that cases we cannot keep it confidential, right? So
right,
that is how ethically we can handle the situation. And I feel that it's very important that you make it very clear at the first session itself. It should not happen like you're halfway through some of the sessions and then you just drop the bomb. Okay, now you have shared it with me, now I'm going to share it with your significant guardians or parents. That will come as a shock. And even when you are disclosing this information to any third party for their safety, um, if possible, always have first have a direct conversation with the client that this is the reason that I'm disclosing this particular information to your guardian or your friend or anybody, any loved
mhm.
one. So I think that's how we can ethically kind of proceed with a client. I hope I could answer your question properly.
Is there any correlation between having a mental disorder and suicidal ideation?
Most literature says yes, it does. In terms of if you see the psychiatric disorders like
Mhm,
major depression disorder, then if you see bipolar disorder, psychosis, all this have a significant correlation with the existence of the suicidal ideation, and some successful suicide can
mhm.
also happen due to the mental health disorders. Yes, so there is a correlation.
So is there any standardized test to determine whether someone has suicidal tendencies?
I am not sure because I do not use any standardized tool to kind of assess
Mhm.
suicidality. It is basically through,
Subjective,
kind of uh,
right?
some kind of counseling skills or questioning, probing, and there's one particular skill, suicide
Mhm.
prevention skill, which is called the QPR technique. So basically I followed that in my intervention as an intervention, and also kind of probing and doing my assessment. So I'm not really sure if there exists because I
Mhm.
do not belong to the clinical aspect. I'm a counseling psychologist, so
Mhm.
I do not deal with tests and tools more often. It's more of counseling skills that I use in my practice sessions.
Could you elaborate more on the QPR technique?
Yeah, definitely. So, the QPR technique is one of the most cost effective and heavily researched and proven intervention of suicide. So, the QPR stands for question, persuade, refer. So, the basic tenet of QPR is similar to CPR. Okay, so you know what is a CPR, right? So, the basic okay, so
Mhm.
CPR is a technique that
Mhm.
uh, if someone is having a heart attack, right?
Mhm.
And the CPR technique is given to that person, and the person
Okay, okay,
can,
right, right, right,
yes.
right, right. Mhm.
So the basic principle comes from the CPR
Mhm.
CPR principle, where it says that anyone who knows CPR can save a life, right?
Mhm.
So suppose you are just walking. Suppose any person might be walking somewhere in a store, in a mall, or in a beach, and suddenly that person is having a heart attack. Suppose if all the ordinary citizens around are
Mhm.
trained and skilled in CPR, they might be able to help that person save his life before the medical help reaches the person, right?
Mhm.
So similarly, in QPR approach, we believe the basic principle is that everyone can save life. You do not need to be a trained psychologist or a counselor to save a life. If you apply these three skills, you are able to save any. any person's life, right? So the three skills that briefly talks about is question, persuade, and refer. So the first point is question, like if you are seeing some signs and symptoms
Mm-hmm.
in a person related to suicide, so you have to ask the direct question. So there is a lot of myth around suicide, that if you ask the person about suicide, the person might you might instill that in their brain. Okay, that now I have you have instilled that thought in their mind, but that's a complete myth. Okay, so
Right.
there are two ways to go about this, either a direct way or an indirect way. So in
Mm-hmm.
direct way, you can simply ask the person, are you thinking about suicide, or are you planning to end your life, right? So you're opening the doors of conversation, you are asking a very critical question at that point in time, and you're also expecting an answer from the opposite end. And the other way of, if you're not very comfortable asking this direct question, you can
Mm-hmm.
go about the indirect way, maybe something like, do you wish to go to bed and not wake
Mm-hmm.
up one day, right? Do you feel that your pain must end someday, right? So something indirect way. So it's very important when
Right.
we ask this question, we should be we are in a position to listen, right? It's not that you just throw that question and then you're not able to receive that answer. So
Mm-hmm.
it's important to be present, to be non-judgmental, empathic in that particular situation, and tame our own fear. Because I remember when I was not trained enough, when I was
Mm-hmm.
also a new counselor. So it was difficult for me also to kind of assess this
Right.
particular part. And I'm sure, and I know for a fact, a lot of counselors, young counselors, also struggle with it. So it's important to tame our own fear and then be present for the other person. So first is questioning, that I told you. Second is persuade. So persuade, as you know, that you have to kind of uh, persuade the other person to get the necessary help, right? So whenever we are doing this persuading, again, the same skills we might apply, that uh, assuring the person that you will be there for them, and kind of you will be able to get help for them. Sometimes just a simple promise, that promise me you will not harm yourself until we get proper help for yourself.
Mm-hmm.
So this kind of persuasion and negotiation, maybe at that point in time, for the person to be able to get help, because a lot of people don't believe that they can be helped out in the situation that they are in. So it is very important for us to give that hope, that kind of resiliency, empower them, that okay, it is possible. It is possible that you come out of this thoughts, you come out of this
Mm-hmm.
overwhelming feeling that you are dealing with, right? So persuade is the second part. And the third part is refer. Refer means you have to refer them to a mental health professional. Maybe you can, sometimes you can make an appointment for your friend or anybody, if you see that they are going through this. Sometimes you can accompany them. Oftentimes they agree to get help, but they don't do it by themselves, right?
Mm-hmm.
So maybe someone can accompany them and get
Mm-hmm.
that entire thing done. So this is simply three. If anyone is interested, they can read more, or they can get this training for themselves, the QPR training. It's a gatekeeper training, and I absolutely recommend it for every counselor out there.
Right. Okay. So, if someone is feeling suicidal, should they be hospitalized to keep a check on them?
See, again, I said, if someone is just feeling suicidal, we don't need to hospitalize them, right? It's
Mm-hmm.
a thought. So again, the probing things comes up. uh, are they are they really having an intent to die, or is it in the thought stage right now? If it's in thought state, certain intervention can be done at that level to reduce those thoughts. And if it's intent, again, we can do some interventions and reduce that intent as well. But hospitalization again comes
Mm-hmm.
when it is absolutely very the client is absolutely critical, and the client is unable to make any decisions for themselves, right?
Right.
uh, that is the point where
Mm-hmm.
we we can consider hospitalization and the person is completely needs to be taken care by other people,
So
right?
is his
So
consent necessary?
that's a very good question. Is consent necessary? Again, I think that's one of the ethical dilemmas
This.
out out there, right? If uh, if the client is in a
Mm-hmm.
very critical stage, right?
Mm-hmm.
Um, the immediate caregivers has to be notified at that point in time. Okay. um, I think that is absolutely crucial at that point in time. And since you have already mentioned it at the beginning of the session that your privacy, I mean, your life is more important than your privacy. So then we have
Mm-hmm.
to kind of
Yeah.
inform the
Mm-hmm.
guardian. So if the person is at a stage where they can give consent, we can definitely ask. But I think at that critical moment when someone is dealing with life and death situation,
Mm-hmm.
we have to make the
Yeah.
decision uh, at that point in time, right? So I have uh, I'm not sure because I have not reached a point where I had to do it myself, something like this. But yes, there were two, three situations where I can share what I did. So basically, one of the individual
Mm-hmm.
he shared a photo with me actually, and it had 5 to 6 deep cuts in his arms. Okay, so it was just a photo, and I I was going through I was going through a wedding actually that time. So I was in no position to kind of immediately connect with him. So so I connected with my senior psychologist immediately. As soon as I received the photograph, I connected with my senior psychologist immediately
Mm-hmm.
because I was very young at that time, and I was very new into the profession also. My senior psychologist suggested me that you have to immediately inform the parents, right? And it was a minor, uh, it was a minor child who has done it.
Mm-hmm.
So she told me that you have to immediately inform the parent, and you have to uh, guide the parent that they have to take the medical help as soon as possible. So that's the intervention I did at that point in time. I immediately connected
Mm-hmm.
with the parent. Thankfully, I had the parents' contact details. I connected with the parent, and I immediately told them that he needs, medical attention as soon as possible. And that was done. So it depends, Akash, actually on the situation that you are in.
Mm-hmm.
For me, it is always a clear choice that life is more important than privacy. That is how I see it. Other counselors can agree or disagree. So
That's a good philosophy, I think.
everyone has a different approach actually.
Right.
Yeah.
What are the therapeutic interventions that can be used when a person is going through self-mutilation?
Mm, I can talk about myself, like how
Sure, sure.
I proceed with things. So my approach is I follow humanistic school of thought,
Okay.
The Rogerian, uh,
Mm-hmm.
therapeutic guidelines, and my approach is also very non-directional. I don't direct my clients to do this, to do that, right? So uh, that is my approach, how I be in
Mm-hmm.
the session, very empathetic, non-judgmental, holding space for my clients and making them feel safe. Actually,
Right.
that's very important because I have worked with a lot of children. My career started with working with children. So close to 3 years, I was working with
Mm-hmm.
children. So sometimes even if they self harm, they will not tell you until and unless they feel safe. And if they don't tell you, how are you going to help them? So it's very important that we make the space safe for them to at least open up. Once they are kind of opening up to their
Mm-hmm.
difficulties or challenges that they are facing, and also opening about the fact that they are self harming themselves. It is important to kind of understand why they are doing it, what is the
Mm-hmm.
reason for their self harming. Most often than not, it is kind of a coping mechanism. What I have experienced in my career, most of them have said that we don't know how to cope with this emotion, so I just do it out of anger, out of frustration, out of hopelessness, right? So you have to look, see, every client is different, so you have to see the individual requirement of the client, make a tailor made, I would say customized
Mm-hmm.
treatment plan for the client. And then you proceed towards something I do it myself is do that's called a safety plan, right? So so the safety plan basically incorporates it's kind of a guideline for the
Mm-hmm.
clients, like as the name suggests, safety plan. So number one is identifying when is a crisis situation is coming to you, right? Is it a thought, is it a behavior, is it an emotion? So this makes it easier for them to identify their emotions. So
Right.
suppose if I am getting very angry, so
Mm-hmm.
maybe next I will be self harming myself. Or if I'm feeling very, very low and frustrated, I am going to self harm myself. So that identification helps them to
Right.
understand that, okay, this is the crisis moment that I will be going to indulge in
Mm-hmm.
a self harming situation, right? So that is one. Then, second, coming up here, what are the internal coping mechanisms? How do you generally cope? So every individual has some or the other coping mechanisms. Someone copes with music, someone with talking to friends, someone kind of separating them from the crowd and just sit idly. So everyone has different internal coping mechanisms. So you have to kind of tap into that, make them realize, maybe 5 years pehle they used to do something which they have completely stopped doing it now. So again, you have to kind of ask and kind of probe what are the things that made them feel better when they were in such situation. So list down all the internal coping mechanisms that
Mm-hmm.
they already have. The third part could be, connecting them. Oh, sorry. In the second part, internal coping mechanisms, you can share some ideas on other coping mechanisms also, right?
Right.
There could be multiple other coping mechanisms that you can also teach them. It's not
Mm-hmm.
that you are forcing them, but it's kind of brainstorming. Okay, do you think this might work out for you? Do you think you could give it a try? Do you think you can work with your senses, the mindfulness techniques, right? So those kind of things you can introduce to them. So it's kind of a breath of fresh air, because they don't know that this kind of things can also help them kind of release their pent up energies and stress, right?
Right.
So that is, you are introducing the coping mechanisms. The third could be connecting with loved ones,
Mm-hmm.
connecting with their safe people, identifying like whom they can connect when they are feeling
Mm-hmm.
this kind of difficulty. And the fourth could be, giving them resources of helplines, uh, um, maybe 24/7 helpline numbers where they can kind of connect, and they can kind of, in
Are
case
there
no one is
also
available.
support groups available?
Support groups, I'm not too sure, but
Mm-hmm.
yes, there exists support group. Facebook, I have seen some support groups that exist,
Mm-hmm.
but I'm not very sure about the authenticity of the people who are
Right.
posting or who are suggesting. So, uh, uh, if we have some, known resources that where people can kind of connect, so I think
Mm-hmm.
that helps. So you are just giving a lot of uh, options to the person that, to deal with their
Mm-hmm.
emotions. And eventually once you build the rapport with the client, once they also see the process is evolving, they are seeing making certain changes in their life, things starts to fall into place, things
Right.
gets better, things get better. I have seen it in my experience and in my journey.
Right.
Yeah.
This point that you raised about mindfulness, I feel that is very important. Could you like describe that if someone is feeling low and wants to injure themselves or wants to commit suicide, so how can they apply mindfulness?
Can you reframe the question a little bit?
Sure. If someone is having suicidal ideation or the urge to self harm themselves, how can they apply
Hmm.
mindfulness techniques in order to prevent? Right.
Okay, okay. So
Mm-hmm.
basically, what I teach them is the five senses, which is, first you
Right.
teach them about the five senses that we have,
Right.
the
Right.
eyes, the ears, the
Mm-hmm.
nose, the mouth, and the touch, right? So some people are more prone towards one senses, or maybe they're more prone toward two senses. So maybe identifying themselves. Suppose for some, music really helps, right?
Right.
Something soothing music or something loud music which
Mm-hmm.
kind of give them a sense and vibration in their ear, and they kind of be present at that moment while hearing the music. For some people it's the visual aspect that comes into play, taking a long walk outside and just
Mm-hmm.
seeing the bright sky or seeing the night sky, making their observing the patterns, the shapes, the colors, the texture. So that can
Mm-hmm.
also help them to calm down with their with the touch, maybe placing an ice cube in their hands,
Mm-hmm.
something extremely cold, and that can kind of soothe down their
Right.
felt emotions. Or
Right.
someone taking cold water, splashes of cold water,
Mm-hmm.
taking a hot shower or a cold shower, something to do with their sense organs. So that kind of techniques kind of helps certain individuals to be mindful and kind of distract them from those thoughts and those emotion at that moment.
Right. I've also read this concept that you can apply red paint to wherever you feel the urge to harm yourself.
Yes, yes, right. That's a technique that works with children very well, right?
Mm.
If you're feeling an
Right.
urge, sometimes if someone is punching a wall, right,
Mm-hmm.
you tell them to punch a pillow, so you are still punching,
Right.
but the blow is very
Right.
soft.
Right.
You will not harm yourself, you're still
Mm-hmm.
punching, but you're punching a pillow, a soft pillow.
Right.
So
Right.
if you're feeling like harming yourself or cutting yourself, just do it with a red pen, or mark yourself, something
Mm-hmm.
that I have also read it, right? True.
Right. So, if somebody is feeling suicidal, what steps can they take?
When someone is feeling suicidal, I think reaching out is very, very important at that
Mm-hmm.
point in time, because once it's a thought, it can, with the given circumstances, it can get into an intent, and then it can become a full blown plan,
Right.
right? So I think when we are having that thought within
Mm-hmm.
ourselves, I think reaching out to a trusted person is very, very important. It could be a friend, it could be a parent, it could be a significant other, but at least confiding in someone who can, kind of understand the situation,
Mm-hmm.
not judge the person for having those thoughts, and also kind of, guide them for the next process. And connecting with a mental health professional can also kind of ease out some of the things for them.
Mm-hmm. Okay. So, my last question: how can someone contact you?
They can connect with me through LinkedIn, they can
Mm-hmm.
connect with me through my page. I have a page in Facebook also called Psychological Counselor. I'm on Instagram also called Psychological Counselor. So they can just search me and they can find me. My full name is Shahnaz Rahman.
Yeah. Thank you, Shanaz. You've been very insightful.
Thank
I'll
you.
pause the recording.